If you think about it, it's pretty unique that the University of Missouri has a medical school, a law school, and a veterinary school all on the same campus. In addition, they have a large academic medical center with a full array of graduate medical education programs.
The fact that we have the University Hospital embedded in the University of Missouri with the School of Medicine adjacent, we have a School of Nursing. It's so rich in terms of the kinds of learning that we're able to do from each other clinically and beyond our clinical activities.
So we have a full array of educational experiences to offer our trainees here. We have grand rounds, we have morning report, we have noon conferences. All of our divisions also have their own divisional grand rounds and subspecialty lectures that they give as well. I think the combination of the larger academic medical experience in a sort of smaller, tighter-knit community is really unique.
We have a pretty big residency program. We have a lot of subspecialty fellowship programs. So we're surrounded by people who are learning, who are generating new knowledge, and are here to take great care of patients.
We are a large academic medical center in a medium-sized town, and we have this great combination of, a great variety of clinical cases coupled with a great lifestyle. So we really are the medical center for the state of Missouri. We get referrals from all the corners of the state. And that really gives us a nice combination of sort of the routine cases that we get from our own community and the immediate surrounding area, as well as the more interesting cases that get referred in from elsewhere.
Our three organizing focus areas are clinical excellence, exemplary education, that's why people come here to learn, and exemplary research. The care of Missourians and discovery that lets us affect the care in a positive way for people beyond Missouri is why we exist as a land-grant School of Medicine. I think we're a really nice balance between a big enough program to have the diversity of people, of ideas, of experiences that we need for a really strong residency program and really strong fellowships, but small enough that you're not going to be a face in the crowd. People will know you, people will see your work, people will follow up with you.
The most important thing to me is that no fellow who graduates ever feels as though they are incapable of taking care of someone.
To me, wellness is more of providing a supportive environment for the people that work there, and so it's about trying to engage people, making sure that we're listening to their concerns, acting on those concerns when we can, understanding that each of our trainees is a unique person with unique circumstances that sometimes requires a unique response. Don't really believe in the cookie-cutter approach to personnel management, and more understanding that everybody comes to this with a unique set of experiences that has to be dealt with in an individual way.
We pride ourselves in training our fellows to be really excellent clinicians and excellent rheumatologists. Our fellows are ready to go in a busy clinic from day one.
When I was looking for Rheumatology Fellowships, I really wanted a program that was going to prepare me for life as a rheumatologist out in the real world.
We do that because we have a lot of clinical training. We have a lot of clinics both at the University of Missouri and at the VA.
We get an excellent amount of diversity in terms of rheumatologic conditions that we see.
Here at Mizzou, we have the inpatient service, the outpatient service that is quite busy with a wide variety of patients. We also have a large catchment area. I mean, we serve folks all around Mid-Missouri. It's not uncommon for patients to come and drive 2 or 3 hours to get to our clinic.
We see patients from all corners of the state. People come all the way from the Springfield area, 4 hours away, to come and get their care done here. So we impact almost every corner of Missouri.
Our fellows have their own continuity clinics, and they follow their patients, and it's their own patients for the duration of the fellowship.
One of the benefits of having both a VA clinic and a university clinic is we see a wider variety of illnesses than we would see with just a clinic at the university or just at the VA. We have opportunities to bring patients in any day of the week to do procedures if they need injections or aspirations done.
We have an ultrasound machine in the clinic, and we encourage our fellows to use it to diagnose and to treat our patients. So we try to make sure that our fellows are able to train in musculoskeletal ultrasound, which is something that is, I think, here, and it's also up and coming.
We are primarily outpatient, so we see a lot of clinic patients. We do have a consult service in the hospital, so we get opportunities to see more acute illnesses and acute presentations of our rheumatic diseases. And we also have the opportunity to do injections, ultrasound, and other things more procedural based as well.
Our fellows get a lot of hands-on patient care. I mean, the first and the second year of fellowship, you have the same number of clinics, right? There are fellowships where the first year you have a lot of clinics and then the second year you have fewer clinics. And we think that doesn't prepare you to go into a busy practice. Most of our fellows do go into private practice both regionally and outside of state. And the way we do it is that the fellows need to be ready to start and ready to go from day one. I mean, I have my own private clinics and the attendings have their own private clinics. The fellows have their own clinics themselves. So what we do is we attend to those clinics and we help them manage their patients, and that's how they learn. So I think that's an important plus. We have surveyed our fellows after they graduate, and they have told us, right, that one of the good things about the program is that they're ready to go from day one. They don't have to ramp up in order to be busy in clinic, because once you're in practice, it gets much busier than you were a fellow, and you can only prepare so much. But we feel like we prepare them to get there, to be in practice really from day one.
So I think one of the unique things we have about our program is that it's a smaller size. And that gives us a lot of one-on-one time with our clinical faculty, and they do a great job in teaching us, and you can tell that they really care about our learning and our development as future rheumatologists. So we have a very relaxed environment in rheumatology. Our clinical faculty are easy to get along with. They're very accessible and create an excellent learning environment.
The work culture here is of constant open communication. I like to tease that in our division we don't have faculty meetings because we basically meet every day in clinic all the time taking care of patients.
In your first year, there's a little bit more supervision, and then in your second year the faculty do a good job in letting you develop your own plans and then give you good feedback on what you're doing.
We're always together, we're always working together, it's always a team. So we have the attendings, we also have nurse practitioners, and of course we have the team of nurses that work with us in clinic. Our clinic is set in the multi-specialty clinic, and in the same building, in the same clinic space, we share space with the nephrology doctors, with the pulmonary doctors, with the infectious disease doctors, with the gastroenterology doctors. And our patients with systemic rheumatic diseases often have kidney problems and lung problems and infectious complications. So I think the setting where we're at, the physical space that we share with these other specialties is also very helpful. We also have a rheumatology dermatology clinic where we see patients together with the dermatologists. And we're working on setting up a pulmonary rheumatology clinic, where we would see patients with the pulmonologists also. And we also have very close a working relationship with the ophthalmology department. You have to be a little bit of a detective to be a rheumatologist. You have to know a little bit about the eyes and the ears and the lungs and the kidneys and the skin. We are amateur dermatologists. Many of our diseases manifest in the skin. So you have to be comfortable with uncertainty. You have to be curious. You have to be willing to learn about things that are not necessarily rheumatology related. At least you don't think they are, but they actually are. You need to be a good internist. I tell residents in internal medicine who are interested in rheumatology to not read rheumatology at all, to actually get better and to study and to work on everything else. You have to know a little bit about heme, you have to little bit about the lungs, about the kidneys, about the heart, to be a good rheumatologist. So focus on everything else, and then when you get to Rheumatology Fellowship, that's when you're going to start learning rheumatology.
Every Thursday afternoon, we have conferences where we'll go over interesting cases that we saw. We'll also have lectures prepared by our faculty. We also do a good job in inviting external speakers to come and talk. So we bring knowledge in from all over the country to come and teach us.
We have almost weekly case presentations where everybody shares the interesting cases that they saw in clinic. We also have, of course, a journal club. The fellows are asked to present 4 updated grand round presentations a year. Then the faculty also have grand rounds presentations every year also. We also have some interesting, again, multidisciplinary, outside of rheumatology lecture opportunities. So we have lecturers come in from the Department of Dermatology to discuss, mostly, the rheumatology, dermatology patients. We have faculty that come in from the Department of Pathology. We have a renal pathology lecture that happens almost every year. We have a muscle and nerve pathology lecture that happens every year. And then we have providers come in from the Department of Orthopedics and the Department of Pulmonology, Department of Infectious Diseases to give presentations also. And then we do the usual board preparation sessions and things like that. I think the jewel of the didactic portion of our division is what we call the QICDS, which is the Quality Improvement Case Discussion Series. All the fellows and all the nurse practitioners and all the faculty get to come and bring their cases in a kind of informal setting where they can just discuss interesting diagnostic and management and quality improvement problems that need to be addressed, and we can all kind of work on those together.
Our program actually encourages you to go to at least one conference a year, even in your first year of fellowship.
And I should say we're proud of our fellows because every year they're able to put out publications despite being quite busy in clinic.
It's just a really wonderful size and balance between all of the energy and excitement and forward thought of an academic medical center with a place that's easy to live.
By having the university here, it brings in enormous amounts of diversity and other opportunities to explore things that you might find only in a bigger city.
I do love this town. It has a charm to it. I feel like people they smile, when you meet them. And I've been to many big cities and you don't have that, that friendliness.
There's a huge network of trails for walking, running, biking. There's local breweries and a vineyard. There's some distilleries around.
I can go canoeing, kayaking, bike riding, right from my house.
I have 4 kids and our public education system is top-notch.
Much of Columbia is focused on education and healthcare. Because of that, we draw more culture to Columbia and have more of a cosmopolitan feel than other towns our size.
You're going to have most of the big city amenities, theater, ball, we have Division I in athletics, of course, the Missouri Tigers, members of the SEC Conference.
We're looking for people who are curious, who are flexible, who don't expect everything to be the way it is today and want to be part of that change. People who demonstrate curiosity, flexibility, and also just a deep and unfailing commitment to their patients.